a patient shared today that her primary care had told her that basically she needs to think about coming to a place of acceptance with her symptoms. Ugh, that makes me so mad on so many levels. She told her, just be aware you shouldn't be doing anything extreme, and maybe you need to come to a place of acceptance with your symptoms. I don't think that that is okay. So don't let your doctor put limiting beliefs on your situation, number one. Number two, there's always something we can do to add health to the body. So conventional medicine, you guys have heard me say this a million times, it's wonderful for emergencies. Surgery is amazing. It's life-saving. I had that experience with my pet this past week, right? So I'm not poo-pooing conventional medicine, but there's a big gap between when people get sick and when people need serious drugs and serious surgery. And if we can intervene in that gap and move you back towards health and rebuild your health from the cellular level up instead of just looking at everything from the disease level down. So many of you have told me that you have been told, oh, your symptoms aren't bad enough yet for you to get treatment, so come back when you're sick enough, which is insane when you think about it. Why would you wait until you're sicker? And why would you listen to somebody who has that opinion? So, in our clinic, all of my patients have primary care physicians because no one person can fulfill all your needs. So we need a team to make sure that all your bases are covered, and no matter what comes your way, you always have somebody in your corner. And that's why we do things that way. So, this person has in 1 month really already moved the needle so much with their health. Just 1 month of treatment, working on going to sleep at the right time, working on their nutrition, and really noticing what the triggers in their environment are for their symptoms. So, it's interesting to me and bizarre to me when conventional doctors will think of root cause medicine or functional medicine or naturopathic medicine, and they label it as extreme. And it's like, it couldn't be further from the truth. Even though the way that I think about the body might feel radical from a conventional perspective, what we do in the office is actually very conservative and safe, because we're focused on nutrition, we're focused on supplementation, we're focused on mindset and lifestyle. So those are all the safest things you could ever do. And as long as there's not something emergent going on, then that's exactly where you should be. So don't let your doctor limit your beliefs. And then also that carries over to you. So another patient was struggling today with, really being on a long journey, and we've just started up working together. And, a persistent thought for them is, what if they never get better? So in the same way that, don't listen to anyone who says that you can't have more health and that you can't have a bigger life, because you can. In the same way, if you have those beliefs coming up that you're worried that you're never going to get better, we need to deal with that as well. And so here's a tip I have for you, and this worked really well for a brand new patient. She just started last week, and she came in, and one of the things we talked about in her first session was automatic writing. And she had a very profound experience with this alone, so I wanted to share it with all of you, and it really ties into everything we've been talking about. So automatic writing is basically setting a timer for 10 minutes and pen to paper, not typing. Pen to paper is way better for integration of learning and bringing the emotions out and all of that. And what you do is you just start writing. And you might not know what to write at first, and that's totally okay. So you can write, I don't know what to write. I'm not sure, what I'm feeling. You can just say that over and over again, kind of like Bart Simpson and the chalkboard, if you've ever seen that. So I don't know what to write. I don't know what to write. I don't know what to write. And then soon things will start coming up. And if you set a timer for 10 minutes, you'll probably write a lot and then look at the clock and be like, oh my goodness, it's only been 3 minutes. So this really goes deep. So a lot can come up. And then the next thing that you do after the timer goes off is you want to go outside and go for a walk. Make sure that your arms are free, so you're getting, that bilateral crawl as you're walking and swinging your arms. So, don't be carrying any bags. If you have a dog and you're doing a leash walk, if you can tie it around your waist, or if you can, still have the ability to swing with your leash in hand, then that's fine. But this is doing two things, is you're letting it all out in the writing, and then when you're going outside and you're moving your body, you're actually integrating this on the different sides of your brain, and you're activating everything from a cellular level to get rid of it. Because when you are feeling stuck or uninspired or sad, one of the best things that you can do is move your body. So go out for a walk or turn on some music and dance it out. So you really want to like cultivate this acceptance and this confidence of yourself, and then you want to shake it into your cells. And so I know that a lot of you said you're interested in Qigong. We're going to figure out how to do that. I haven't moved forward with doing a Qigong class because I wanted to do it in the park, and the smoke season, it's really not appropriate to be, working out outside at the moment. So hopefully that will wrap up soon. We'll be able to do that. So this patient who just started last week, really the things that she did is she added some avocado into her routine, and she did the automatic writing, and she said she had a profound experience with releasing anger that's been there, since she was a little kid. And so she was totally elated, and her response to that, I just thought I would need to share it with all of you because it's so simple and it's so powerful. Yeah, so you guys, let me know if you have any questions. That's what I wanted to share with you guys today. A lot has been going on, and I'm always here to answer any questions. So you just let me know if you have them, and move your body, try that automatic writing, and don't let anyone create limiting beliefs for you. Don't let anyone tell you what is possible, because the truth is most people don't know what is possible. So the doctor who said that to the patient, she doesn't know that healing is possible from these conditions because she's not experienced it, right? And actually, I've had conventional doctors apologize to my patients because they've said things like that and said, I don't know if this is going to get any better, or I think this is as good as it's going to get. I've heard this a lot, and then the patient goes back as living proof, right? And then the doctor says, wow, I'm sorry, I didn't know, now I know better. So, we move the needle forward, we move our movement forward, we move our health forward by being the living proof. You all have a thriving force, you're all beautiful, you're all perfect as you are. We need to bring out that confidence, we need to push you forward. I want to pull you forward into action so that you can get the health and the life that you deserve. So hope that helps. Let me know what your questions are, and I'll talk to you guys again soon.